Clinically, I was trained as an emergency physician, but I've also had a passion for medical education throughout my career. During residency, I pursued a master's degree in higher education, and since joining the faculty, I went back part-time and earned my PhD in higher ed. At the MHPE, I initially was one of the founding faculty members and stayed on as admissions chair, as well as a subject matter expert in research and scholarship. But now I've become the director of the program, which is incredible, and I'm so excited in this new role. It was the first competency program in MHP, and it continues to be a national leader. We don't have traditional classwork like many other master's degree programs. Instead, we have a mentor-learner relationship that drives the program, where learners work on what are called EPAs, which are projects that they would do as part of their usual work, but do them in a scholarly way. And that allows our learners the chance to learn where they work, learn on the things that they're most passionate about, and directly reflect as a competency-based model should, that they actually have the skills and knowledge that we expect a master's degree student to have, versus kind of the somewhat artificial sometimes classwork that, where there's a belief that, scores or grades translate into competency, whereas our program actually directly measures it. Our program is actually well tailored to a learner who wants to both focus on what they're good at while expanding towards what they don't know yet, and lets them tailor their experience to what their needs are. Whenever a learner joins the program, they're assigned a mentor, and they work one-on-one with that mentor to really drive their learning and drive their participation in the program. That they meet regularly with the mentor on the learner's schedule to decide on what EPAs they're going to pursue and to what competencies they need to complete for graduation. They also have the opportunity to work with our subject matter experts, and they're subject matter experts in each of the competencies, and actually often more than one subject matter in some of them, so that they can get additional learning from an expert to supplement what they're getting from their mentorship relationship. Finally, they work with the assessment committee, which has our faculty review the EPA submission. So when a learner completes an EPA, they do a write-up or potentially a presentation to the assessment committee. And that's meant to be an iterative process where the learner gets feedback about what they've done and whether they've reached competency in all the domains of the EPA and what they might need to work on again. I think learners spend more time with individual faculty in our program than perhaps in others, because they're not in a classroom and they're not one of 30 students. I think it's a strength, and it's something that's unique about Michigan's MHPE program. We're looking for all kinds of candidates for our MHPE program. It's intentionally built not just to be for physicians, but to be from any member of the allied healthcare system. We've had graduates from, of course, medicine, but also nursing, dentistry, translator services. We've had people that are more involved in administration of educational programs versus scholars. The program really is nimble and flexible enough to accommodate a lot of different types of learners from across the healthcare system. We want people to be able to apply what they're learning and learn from what they're already doing in their job. And that requires them to have some connection. Now, do they have to be dean? Certainly not. We've had learners at all levels of their careers be successful in the program, seeing where the learners go, seeing how they become engaged further in health professions education, and how they translate that into a career that's fulfilling and brings them joy. I mean, the learners are doing all the work, and we get to just enjoy being a part of their lives. I've seen our learners go on to become leaders at their own institutions. I've seen our learners go on to become medical education scholars at the highest level. I've seen our learners go on to revitalize the program they're running. I've seen our learners go on to be passionate about their work more generally. It's one of the most rewarding parts of being a member of the program. I think our program is amazing, and I think it's exactly the right program for a lot of people. But I think they should think about exactly what they're looking for in their next phase of training, because our program is different. It requires a lot of self-starting. It requires a lot of passion to keep working towards their goal. It requires the opportunity to put EPAs into work. Does our program meet their needs? Because really what we want to do, and I can speak as the former chair of the admissions committee, is we want to make sure that learners are going to be successful here. We don't have the desire to lure somebody to the MHPE program here who's going to struggle. Our goal is to support our learners the best that we can. So I would have them think about, do I want a competency-based program? I think there are huge advantages to it that we've already talked about. I think that you come away from our program with the confidence that you might not have after training in a traditional classroom, that you can take what you learned and apply it, and that you're ready for the next step of your career. Learning health systems are the natural evolution of kind of the evidence-based medicine movement to an evidence-based education movement. I think that kind of data-driven science is going to be incorporated increasingly into the everyday work of educators. And I believe our learners are going to be in a position to be leaders in that movement. I'm immensely proud of the MHPE program. As one of the initial faculty members who helped develop it 10 years ago, I've seen it grow from kind of a crazy idea that some people really wanted to make happen to a national leader in the field. As a director, I am committed to continuing the proud tradition of supporting learners where they are and helping create leaders in the field.